A warm welcome to AD4 TV Radio News Update, coming to you live from Abuja, Nigeria's capital territory. I am Gracious Ogun. Nigeria's President Muhammadu Buhari has reviewed upwards the National Research Fund of the Tertiary Education Trust Fund (TET Fund) from 3 billion naira to 7.5 billion naira for the year 2020. TET Fund's Executive Secretary, Professor Suleiman Elias Bogoro, who disclosed this at the Board of Trustees annual retreat of the fund on Wednesday in Abuja, said that the latest approval makes the agency the largest holder of research grants in Nigeria. He added that the president also approved the establishment of 6 medical stimulation research and clinical training facilities in 6 colleges of medicine in each geopolitical zone within the year. This authorization, he said, has given TET Fund the opportunity to provide 12 COVID-19 and related infectious diseases molecular laboratories, 2 in each geopolitical zones, making the fund the highest single provider of the disease test centers nationwide. President of Peru, Martin Vizcarra, on Wednesday threatened to temporarily take over private healthcare clinics in the country if they failed to reach an agreement with the government in 48 hours over the fees for treating COVID-19 patients. For 3 weeks, private clinics have wangled with the government over a fair rate for care amid reports of overcharging for patients who require mechanical ventilators and intensive care. More details have emerged on the guidelines recently proposed by the Federal Ministry of Education in Nigeria to the National Assembly for the reopening of schools amid the COVID-19 pandemic. The document requires schools to create temporary isolation space and fully equipped clinics before reopening. It also recommends that students stay 2 meters apart in line with the Nigeria Center for Disease Control's advice on physical distancing. The guidelines, the ministry said, are to ensure maximum possible safety and protection against COVID-19 infection and effective response if anyone exhibits symptoms, as they are mandated to hold adequate consultations with the Presidential Task Force on COVID-19 and the parents. Universities Minister of the United Kingdom, Michelle Donlan, has promised that the COVID-19 pandemic will not halt the education of Nigerians studying in the country. Dolan explained that the UK is doing everything possible to ensure that academic activities continue, despite the prevalence of the disease, and international students continuing their studies in the UK is one of the top priorities. We'll take a break now. When we return, Africa now has full COVID-19 testing capacity. Stay with us. Details coming shortly.
Mental health and the COVID-19. It is no longer news that the coronavirus disease is now a pandemic. New cases are on the rise and the death rates have increased. People may develop issues of poor sleep, poor eating habits, undue irritability, and uncertainty. Some may also start to cope with the use of alcohol, substances of abuse, and self-harm. While all of these reactions can occur in response to a stressful event, it is important to share tips to help people remain in optimal mental health. 1. Let's normalize the conversation. If you feel anxious or afraid about the virus, remember, you are not alone. 2. Don't self-diagnose. Just because you have symptoms that are alike to COVID-19 doesn't mean you have it. 3. Plug out and limit sources of information to credible ones. 4. Develop a healthy daily routine, especially as quarantine is ongoing. 5. Focus on the things you have control over. 6. Practice social distancing, not social isolation. Utilize online channels to keep in touch with friends, family, and loved ones. 7. Avoid maladaptive coping techniques such as drinking and smoking excessively or self-harm. 8. Educate children, the elderly, and loved ones on social distancing, quarantine, and how to keep safe. 9. Take care of yourself by eating healthy and sleeping well. 10. Create time for self-development via reading and online webinars. 11. If you or anyone you know has a physical or mental health problem, please use your medications and encourage them to do same. 12. Reach out, seek help, and get help should the need arise for your health. Remember that there is no health without mental health.
You're welcome back. You're watching AD4 TV Radio News Updates. Director General of the World Health Organization, Tedros Ghebreyesus, has announced that the laboratory capacity to test COVID-19 is now available throughout Africa. The GG noted that only a dozen African countries had this capacity at the outbreak of the pandemic. He, however, warned that the number of cases is now increasing quickly and more protective equipment and laboratory tests are urgently needed. Africa has more than 320,000 confirmed cases of the virus and 8,500 deaths. In a developing story, the death toll from southern Mexico's earthquake that struck on Tuesday has risen to 10 as locals begin cleaning and assessing damages from the shock. As reported on AD4 TV Radio, the 7.4 magnitude earthquake struck southern Mexico on Tuesday, killing 6 people, rendered hundreds homeless, and forced the closure of a major state-owned oil refinery. Commissioner for Health in Anambra State, Nigeria, Dr. Vincent Okpala, said the state no longer has any active COVID-19 cases as it has successfully treated and discharged the last COVID-19 patients from its isolation centers. This followed the clean bill the state received in the last 2 weeks, as the figures show that it recorded 66 cases of the virus with 40 active cases and 9 deaths. And that's it on AD4 TV Radio News Updates, coming to you live from Abuja, Nigeria's capital. You can join the conversation on our website at www.ad4tvradio.com. Please follow us on our social media platforms at AD4TV Radio on Facebook, Twitter, LinkedIn, and Instagram. Please subscribe to our YouTube channel at AD4TV Radio. Many thanks for watching. I am Gracious Ogun.